at University of Sheffield, and my colleagues Joe, who's a researcher at SHAR, and Ollie, who works with McPin, are going to present. We're going to do this very briefly. And Judy, if only this was finished. This is ongoing work, and it's complicated. This is meant to complement the work that we've just heard, and together, these two, what we call work packages, were meant to answer the joint questions of what is public mental health and how do we measure it. So we, in our program, we're looking specifically at how we might develop a core outcome set that would be the sort of link, if you like, between the kind of concepts underpinning public mental health and future research efforts to evaluate interventions to improve the public mental health. Next slide, please. This, as we've already heard, if you think the beginning presentation was complicated and raised lots of difficult questions about systems mapping and visualization, well, I'm afraid this is no less complicated. And what makes it so complicated conceptually, as you've already got a sort of flavor for, is that when we try to have conversations about what public mental health is, invariably the conversation moves to determinants. Always. People, I think it's, you know, a kind of something reflective of the kind of way that our brains work. But whoever asks questions, and I remember, you know, ONS did an exercise on measuring measuring well-being, and what they ended up was a report where members of the public told them about all the things that improve their well-being, rather than what well-being actually is. So in this work, what we're really trying to say is, what would a mentally healthy society look like? And how could we tell if we had one, or if things that we were doing made us more mentally healthy as a population? And that's much more difficult than it first appears. So we want to develop a suite of outcomes that might be used in future evaluative research. We have been informed by the COMET process. We're not kind of strongly adherent to it because this isn't a particular disease area like many of the COMET projects, but it is a good sort of framework to help us think about how we do this. Next slide, please. This is how we've gone about doing it, essentially. We've worked together with our colleagues who are doing the kind of conceptual thinking about what public mental health is, and we've done some joint consultations around that. We've developed a COMET protocol, but we've also done, as this process has gone along in a slightly iterative way, we've also done the Prospero protocol. So we've got a very clearly defined methodology for our review. We first had to decide what it is that we were going to look for measures of. And that's where the domain map comes in, and I'll come to that in a second. But we needed to sort of think, well, what things should we be looking for measures of before we kind of ask questions about psychometric properties and the like. Then we, having done the domain mapping, which I'll show you in a moment, we've set about trying to find measures against each of these domains. And Joe will talk about this, but we're doing this in sort of two stages. We first look for the measures. We then do a sifting, deciding which are in and which are out, before we then do a second search looking for the psychometric properties of those measures. And we will go back to the people that we consulted with once we've got that sort of short list and we've got some evidence against each of the measures to ask within each domain which to prioritize and which are most appropriate for use in population-based research. If we get as far as this, it would be wonderful to be able to ask whether there were routine data sources that might be proxies for these outcome measures that we might use in evaluative research. Next slide, please. So here's the domain map, and it's complicated, but we've tried, this is a project where we tried to kind of balance pragmatism against rigorousness and inclusivity. And whenever we show this map to people, people will say, we haven't thought of this, and you haven't thought of that. And it's true, but we've tried to make it something that we can actually use in doing the review. One big area are measures of mental illness and pathology and morbidity, and we will come back to those, but there are population sort of indicators of mental disorder, which is one aspect of public mental health. We've started with mental well-being, and Joe will talk to that. We're going to move on to resilience and social connectedness as our next domains. This review could go on for a really long time. Those of you who are old enough to remember, there was a very famous film in the 1960s called The Agony and the Ecstasy, and I often feel like Michelangelo, we we're asked endlessly within the programme and externally, when will you make an end? And I think the answer is when I'm finished. This could go on and on and on, and it becomes more complicated the more we delve into it. And I think other people have tried this before, PHE and others, and what works for well-being, all these sorts of things. And people generally give up because it becomes so kind of onerous and difficult, and we're determined to try to get to the end. I'm going to hand over to Joe now. Next slide, I think.
Scott, and good morning, everybody. I just check you can all hear me now. Yep, I'm not seeing you can't. So yeah, good morning, everyone. I'll just spend a few moments now going through the review process itself. So as Scott mentioned, the review process had two key stages. The first stage involved the identification of the measures themselves, and to do this we searched academic literature looking at for review articles which included measures of mental well-being. So these could be review articles which review the measures themselves, or they could be review articles which reviewed interventions where mental well-being may be identified as a primary outcome. We then identified these review articles and extracted the mental well-being measures, and then we identified a subset of measures which we deemed would be suitable for use in the general population. So by this we mean measures which were free to use, measures which could be administered without any clinical training, and also we didn't want to include measures which were aimed at subgroups or subpopulations. So for example, we wouldn't include measures which were developed for clinical populations or for workplace settings, for example. And once we identified this subset of measures, we therefore took these forward to stage 2 of the search process, where we searched the literature again to identify studies which reported on their psychometric properties. So in other words, which report on how reliable or valid these measures were for use in the general population. Next slide, please. And these are the initial search results from the wellbeing search. So as you can see, we identified around 5,000 articles published over the last 20 years. And then we started screening the title and abstracts of these articles. In this initial screening, we identified that a similar review had been published in 2014, again trying to identify measures of mental well-being. Therefore, to avoid any duplication of effort, we only included papers which were published following this date or ran search strategies following this date. And we ended up with around 28 articles or review articles which included measures of well-being. And from these, we extracted around 250 measures of mental well-being. And we finally narrowed this down to a list of 6 candidate measures. A lot of these measures were simply not measures of well-being to start with, so they may be health-related quality of life measures, or other measures, again, based for different populations and not suitable for the general population. But we identified 6 candidate measures which we deemed suitable for the general population, but we also felt measured overall mental well-being in the sense that they included items which related to the hedonic aspects of well-being, so happiness or pleasure, and also items which related more to the eudaimonic aspects of well-being, so items which perhaps measured purpose in life or psychological and social functioning. And we also at this point excluded measures which included items relating more to negative effect or psychological distress, as we thought these were better placed within the domain of mental illness, which we'll continue to search at a later date. So we're currently searching for psychometric properties of these measures, and we're repeating this process for the other domains, with the hope to have a list of measures to take forward to the Delphi process later this year or early next year. And I'll hand over to Ollie now, who'll talk you through the peer involvement in this research project.
Great, thanks Joe. I'm a little bit mindful of time, but I want to cover this if we can. So I'm Ollie, I'm a peer researcher in the Public Mental Health Programme, and really, next slide please. My sort of goal and aim is that when this research is published, when we have the outcome set and it's disseminated to the public are going to have questions. And I feel it's my role and the role of the peer research as a whole to anticipate some of these questions and seek some of the answers early in the project. And this will help keep the research relevant to the public, and it's ultimately the public that are going to benefit from this research. Next slide, please. So I'm just going to focus quickly on 2 questions that came up, and I'm sure it's one of the sort of questions that we focused on, which one being, how do we decide what goes into each domain? We've got these domains from the map now, how do we decide which goes into which? And one of them being whether to have, how to decide what goes into mental illness and what goes into well-being. And Scott was talked about before, is that there's not enough evidence for these positive mental health measures, and that is one of the reasons that we had this focus. Another question coming up around the determinants versus outcomes, and again, we had a discussion. Next slide, please. So really what I'm trying to say is that these are just a few examples, but it's important to have this engagement with the peer researchers, to have this engagement with the public. And we did this through some workshops facilitated by researchers and peer researchers. And hopefully this can overcome some of the challenges, the technical barriers to the work, the conceptual barriers to the work, and hopefully get more engagement between the researchers and the public and produce better research. Next slide, please. I don't think we've got time for questions unless we do. But in the spirit of what I was saying about asking questions, please do put some questions in the chat. It does help inform the research, and this is a public involvement opportunity in itself. Thanks very much.
That's great. Thank you very much to the three